The former Gauteng MEC for Health, Qedani Mahlangu, has blamed senior managers at the health department for the deaths of 144 mentally ill patients. Mahlangu testified for the second day at the Life Esidimeni Inquest into the deaths of more than 140 patients in the High Court in Pretoria. And she said she relied on senior managers for their professionalism and competence for the June 2016 relocation process. The inquest seeks to determine if anyone can be held criminally liable for these deaths. Now, to speak on this issue a bit more further, we will be speaking a bit later on to, of course, Dr. Mvuyisi, but let's continue with the story. Mahlangu says the initial relocation plan was to transfer the mentally ill patients from Life Esidimeni facilities to government-owned facilities like unused hospitals, but health department officials later informed her that the facilities are not ready for occupation. Instead, some patients will be taken to government mental health institutions like Vescopies and the rest to NGOs as part of the deinstitutionalization of mental health. Mahlangu said she only met with the team dealing with the Life Esidimeni debacle whenever she was available. Of course, a bit earlier on, I said we will be speaking to Dr. Mvuyisi Mzukwa. He is from the South African Medical Doctors Association. Thank you so much, Dr. Mzukwa, for joining us here on the late edition. I don't know if you were listening in on us. Of course, today was day 2 of the inquest, and of course, hearing as well from the former health MEC, Qedani Mahlangu, also saying there that she was not solely responsible for the decision to actually move these patients to NGOs, and also saying that she was dealing with professionals here. And of course, she speaks of those officials who were involved in the moving of these patients. What do you make of her testimony so far over the past 2 days?
Good evening to you, Bali, and good evening to your viewers as well. I'm not expecting anything very informative from Qedani Mahlangu, because you'll recall that all they are doing now is self-defense, and there's no truth that is going to come out from. I don't expect any truth from those politicians. Remember, professionals have been always complaining about the encroachment by politicians in the administrative space, and you would expect that in this case, there would be a separation of powers between politicians or political heads and the administrators. But that's not what we've observed so far. And you'll recall that most of the time, these people don't want to write it on email. They don't want to write it anywhere. They give you a verbal instruction so that at the end of the day, they cannot account.
And, like you say, it's just a blame game that we are hearing from the former health MEC. At the same time, she has put the blame on the doorstep of even the former premier of this province, and of course saying that it was not her who actually took these decisions, and these were decisions that were collectively taken in meetings with the premier. When you look at this testimony and what it says about these decisions which were taken, were you expecting the names of the former premier to come out?
No, honestly, I didn't expect that. But at the same time, he is the former premier is the political head. You'd expect that, in major decisions like this, even if it was not part of that, the former premier would be informed in terms of what has been happening in the province as the political head. But like you said, even in your introduction, that we are dealing with a blame game here, where everyone blames, other people, and they themselves are innocent in this whole saga. But we know very well that in Gauteng, it has been shown, in many cases, that, politicians are involved when decisions are taken, because it involves monies. Where there are monies, you must know where there is money, you will find a politician. So it's expected that you'll see some of them popping up when it comes to this inquiry. and would expect that it's not only the mentioning of names, but there'll also be evidence, that points, or even making sure that these people are held accountable. And I'm glad that there's this inquiry, because many a times, these politicians, they take decisions, they force professionals to take decisions, and they're not held accountable.
And I was going to come to that. I mean, because this has been going on now since 2016. Of course, at the same time, we are dealing with human beings here. We are dealing with families who are seeking closure. And you have just painted a very bleak picture when it comes to accountability. Will these families ever get accountability here? Will they ever find this closure which they seek?
What we've noted is that even though we have, all these inquiries, but we do not see the end of it, where people are held accountable. Look at the Zondo Commission, for example. We just had recently where, some Gupta links were just released, and there was no evidence, or the state could not present a formidable case. And that's what we are looking for. And here, I would not be surprised if, those families don't get to the closure of this matter, because politicians, generally, they protect each other because most of them are involved in this dirty work.
And Dr. Mzukwa, one would also say, because of this inquest, we want to get to the bottom of who should actually be held liable. From your observation, who do you think needs to be held liable for these 144 deaths at Life Esidimeni?
I think it's very important that we understand that, whoever initiated this, came with this idea. And, those that were accountable is, if you look at it, is the head of department, it is the MEC, it is the premier. We don't have many people there. We've got those three that should be held accountable.
Coming to more issues that relate to health matters. Of course, tomorrow, the president has said that there will be a 2-day presidential health summit that will be taking place in Boksburg. As a health care practitioner, what are your expectations of that summit?
The expectation is that the president must account as to what has happened since we had the first presidential summit in 2018, where there were proposals that were put on the table by stakeholders who attended that summit. And so far, I have not seen any progressive report that speaks to the implementation of suggestions that were made by practitioners at that time and other stakeholders in the country. So I would want to know from the president, I'm told that we'll be spending plus or minus 5 million rands on this summit. And it is my understanding that, this is taxpayers' money. You can't keep having summits all the time without seeing the implementations of the suggestions that are made, to government.
And any expectations when it comes to the National Health Insurance Bill?
Well, we understand that there's no, so far we're told that there's no money that is allocated to NHI in such a way that there might be a need to write a proposal to the World Health Organization, for funding. So I think the first thing is to be told where is the funding is going to come from. But the other thing is we need to be told, how far is the engagement, with the proposals or even the comments that were made by stakeholders, to the Parliamentary Committee on Health. I think when the bill was out, when there was a time to comment, all of us, we made submissions to Parliament, even to an extent of making oral presentations. We would want to know if those were taken into consideration, because if they were not, then it means even this summit, it is a waste of our time, it is a waste of our resources.
All right, thank you very much. That is Dr. Mvuyisi Mzukwa from the South African Medical Association. He is indeed the chairperson, just giving us a bit of his insights when it comes to the Presidential Health Summit, which will be held tomorrow. But at the same time, the question around, when it comes to who should be held liable for Life Esidimeni, he says we should put this on the doorstep of government.